Welcome to my new series, 31 Days of Coping Skills. My name is Cassie, licensed clinical therapist, here sharing 31 days of coping skills so that when you come into the new year, you have a whole toolbox. Today, I'm going to talk about reframing. Reframing is this practice of identifying our more negative thoughts and working on reframing them into something more neutral or positive. Now, a caveat. I'm not a huge positive thinking therapist in the way that a lot of times when we try to shift our thoughts from negative to positive, our brain still has this process of like, yeah, that's not true though. And so I like to shift to something a little bit more neutral. If we can shift it to something a little bit more neutral that tends to go over well, your brain tends to kind of like latch onto it a little bit easier than switching from negative to positive. Here are two of my very favorite techniques for reframing. The first technique is, what would you tell your best friend? If your best friend came to you and told you like, hey, look, I'm having this thought, would you say like, you're an idiot? Probably not. You'd probably try to be very understanding, validating, caring. And so I want you to talk to yourself like you would your best friend. Second reframing option we have is to do worst case, best case, and most likely case scenario. Our brain wants to instantly always go to the negative. It's always negative, always negative, always negative. I always ask patients like, okay, we always go negative, but we never sit down and think about like what could like go right. Like I could win the lotto, right? So thinking about options offers your brain this like thing to kind of chew on, to say like, things can be different. That's coping skill number 1. Please follow along for 30 more.